Hey friends and fans, welcome back to the channel. Just got a couple articles I wanted to go over today. One was uploaded by Maxime Bernier. It's a beautiful article that shows the ridiculousness of our spending through COVID and the poor way that our administration handled all this stuff. I just got this fun picture of Captain Idiot with his nice little socks there. And so here's the article. Guest column from David Redman, a retired Canadian Army colonel and former head of the Emergency Management Alberta. He basically goes on to say that there's been quite a few pandemics in the last 55 years. This is nothing new. We have plans for this. We already have an emergency management process. 4 goals of the pandemic plans are clearly defined. Controlling the spread of influenza disease and reducing illness, mitigating societal disruption in Alberta through ensuring the continuity and recovery of critical services, minimizing adverse economic impact, and supporting an efficient and effective use of resources during response and recovery. And then he kind of says, yeah, this isn't what we did. He says the Canadian response to COVID has been incoherent and constantly changing with no plan. The focus has led to a completely flawed response. And yeah, he says in February we knew that over 95% of the deaths in China and Europe were in seniors over the age of 60 with multiple comorbidities, other health challenges. We should have immediately developed options for the protection of concentrations of our seniors over 60 with comorbidities. To date, 96.2% of our 21,000 deaths have been seniors over the age of 60 with multiple health challenges. So yeah, that's all. That's over 20,900. So that's pretty much all of them. So he goes on to explain how if we had focused on, because we knew this in February of 2020, that 96% of deaths were in old age homes and etc. He says we should have spent $2 billion to just help the people in the old folks home. Says could have saved over 1,800 lives with these metrics, I guess. I don't know what his $2 billion was really going to be spent on, but it says to date 73% of Canadian deaths have been in long-term care homes. This should have stopped the need to lock down businesses and spend over $240 billion and force 8 million healthy Canadians to stay at home. So essentially he's saying all we had to do was spend a little bit of money protecting the people in the old folks home, and we would have been a lot better off. Could save $232 billion. But since they didn't have the foresight, they just went and wrote checks everywhere. And tracked $106 billion in federal payments to individuals, $118 billion that has gone to businesses, nonprofits, and charitable organizations, $16 billion in transfers to provinces, territories, and municipal government agencies. Yeah, we did not need to fail the lockdown practices of China. We knew who was the most at risk. Instead, we sacrificed our seniors. So, yeah, we ignored the other 3 goals in our pre-existing pandemic plans, which was minimizing adverse economic impact, mitigating social disruption, and supporting an efficient and effective use of resources. Apparently, they didn't care about those 3. We didn't do any of that. And I'm pretty sure that's self-evident to anyone that lives in Canada. Yeah, so I mean, what are the implications of not caring about societal disruption and economic impact and all this stuff? Like the suicide rates went through the roof, like drug abuse, fucking divorce, it's all through the roof. Like that's what's happened. Anyways, he goes on to explain here a science-based path forward. Canada and our provinces need a science-based path forward. Release a comprehensive 4-goal based pandemic plan showing what's to be done. That'd be a good start if they'd actually do something like that. Vigorously enact a plan to protect our most vulnerable, those over 60. Ensure all critical infrastructure is ready for people who get sick and who need to take sick days. Yeah, I think some of that 240 billion would have been better spent on like more hospital beds or converting hotels and gymnasiums to hospitals instead of furloughing nurses and shutting down hotels. Why didn't we staff up the hotels or staff up the hospitals? Remove the fear campaign from the media. 100%. End all talk of future lockdowns and loosen social distancing rules. Guarantee to keep schools and daycares open. They use Sweden as an example because they didn't lock down. Get everyone under 65 without pre-existing compromised immune systems who can and want to work fully back to work. Continue to vaccinate as vaccines become available. Yeah, sums it up. I think that was a pretty pragmatically written article. Honestly, I don't think he wasn't being too bold. He wasn't attacking. He wasn't taking any stabs at anyone. I think that's pretty pragmatic. It's a good article. I'm glad I went through that one. I agree wholeheartedly on pretty much everything he wrote there. I think that these lockdowns are 100% useless, and like the whole concept of saving one industry at the expense of cannibalizing all other industries doesn't seem like a good trade-off. Like, we got to protect the healthcare industry. We can't have the healthcare industry fail. But you're willing to let like every other industry fail? Tourism, hospitality, like restaurant businesses, resource management, production chains, manufacturing, everything like that. I don't know. It doesn't seem like a very good trade-off to me. Seems to me like they should have just built more hospitals. But what do I know? Anyways, guys, thanks for giving me your time today. I know time's the most valuable thing we all got, so I truly thank you for trusting me with yours. If you like this content, you want to see more of it, just click the like button, maybe subscribe, and we'll see you in the next one. Cheers.